Palliative care essentially is an approach to a group of patients, whether they are young or old, who are facing advanced illness. So the main aim of this is to improve their quality of life. This is not only from the patient's point of view, but also from the family member's point of view. They see that the patient is being cared for and comfortable.
Mr. Ong， 早上好啊！今天觉得怎么样？
So I think we should always talk about death. It's always good to be prepared in advance than having to be forced into a situation to make certain decisions. When it's time, there needs to be a shift in the focus of care. Instead of pursuing curative treatment, we are focusing on a more holistic approach. Palliative care can do much more if we are involved at an earlier stage. This is because we can work with the patient to manage their symptoms, living alongside with this chronic condition. This will also in turn help to maintain or even further improve their quality of life.
Palliative care has moved on beyond cancer, and now we are targeting patients with other diseases such as lung failure, kidney failure, liver failure. This group of patients also experience similar symptoms as compared to their cancer counterparts. Palliative care reframes hope, so there can be hope even if the disease is progressing. Palliative care comes from the Latin word pallium, which essentially means to cloak. So what we are trying to do here is that you can imagine a patient who is suffering from symptoms because of disease, and we are trying to cover up the patient and comfort him. So in palliative care, actually we make a plan for every single patient that we see. This plan is conceived by a multidisciplinary team that includes our doctors, nurses, our allied health professionals as well.
With the support of creative expressive therapy, the patient get an opportunity to communicate, to express themselves.
这幅画你要画给谁呀？
给你们。
哦，你画得很顺手了，现在还记得我们第一次画吗？ Art therapy is using art as the key media of communication. We actually help them to process that feeling and that strong emotion when they are journeying in this stage of their life.
My husband missed his book launch because he was sick and he was hospitalized. When the doctors here heard about it, they went about to do a soft launching. All the nurses, everybody was there. It was a beautiful gesture on the part of all of them.
Under doctor's prescription, patients don't get addicted to opioids. It really depends on the reversibility of the patient's condition. But unfortunately for a lot of our patients, the opioid will start to continue to increase. It's really because of the patient who is suffering from symptoms because of disease progressing. So this is for the patient's comfort and to improve their quality of life. There are a lot of palliative care services out there, including the community hospital, including nursing home, as well as at home. So there are palliative care services that goes into the house directly to support the caregivers and the patient. And eventually, if their wish is to pass away at home, they can do so with the help of palliative home hospice.
My husband wanted the doctor to transfer him to the hospice. The doctors made sure that he was in a proper condition. The medical team went out of their way, so I'm very grateful for that.